Good morning, everyone. We have those beautiful Department of Aging backgrounds. That is so fun. It's like sunshine.
Yeah, we love them.
Yeah, they're great. We have ours too, but a different kind of background. I like them a lot.
Yeah.
All right, everybody. Thank you all so much for joining this morning. Well, I think we sort of hit about critical mass. I'm going to keep letting we've got a couple more people joining right now. And if you could, I'm going to make sure folks just make sure to mute yourself. We decided we wanted to do this as a Zoom call. So we should have about 15 or 20 people. So I think it's enough for us to kind of manage like this. We're going to go through a little presentation just to level set. And then we'd actually love to have a discussion, particularly with the discussion question of why are you all here? Because I think that's actually really interesting. We reached out to you and several colleagues. Some people can't make it, but you probably heard us give a variety of presentations on broadband and telehealth, and we've talked to many of you individually. And so I just wanted to say thank you for all coming today to test with us and see how we can bring more people together from sort of the health and human services space and connect the dots for the broadband community on health and healthcare. So with that, I think we actually have some time. We could actually go around and have people introduce themselves. And if you could, in your name, if you could just put your organization in there as well. I think some of you have it, but it'd be great just because I think you might meet some new people on the call this morning. So I know you all know me, Katie Hydorn with Insure the Uninsured Project. I'm going to let my team member Marissa, who I think most of you also know, introduce herself real quick, and then I'll just go around my screen and call on folks. Marissa, go ahead.
Hi everyone, Marissa Kranak. I'm ITEP Director of Health Policy Research. It's good to see you all.
Thank you. And Marissa's title belies the incredible impact that she has had on this space. She's essentially our resident expert on this. So a big part of the team. Yeah, thanks, Emily. I'm also going to let Emily Cosillo from our team introduce herself. Emily is our amazing person behind all of our programming. So let her introduce herself. She's learning more about the policy today. So Emily, go ahead.
Thanks, Katie. Good morning, everyone. I'm Emily Cosillo. I'm ITEP's Director of Programs. Apologies, my internet's a little wonky, so I'm gonna stay off camera. But yeah, I'm just listening in to learn a little bit more about our broadband work, since this is kind of a new area for us, for ITEP. So yeah, I'm very happy to be here. Happy to see you.
Thanks, Emily. And you probably noticed that we're recording this. This is solely for note-taking purposes, so that way we're not scrambling to try and write down everything you all say. We will not be putting this conversation on a website. We will be putting our presentation on a website as a resource so that you can share it with folks, but we won't be posting the recording. So with that, I'm just going to go around my screen, and that means Moira, you are up.
Awesome. Thanks, Katie. This is Moira Kenny. I'm the Regional Network Director at Unite Us.
Thanks, Moira. Sarah Steenhausen.
There we go. Unmuting. Good morning, everyone. I'm Sarah Steenhausen, Deputy Director for the Division of Aging Policy Research and Equity at Department of Aging. Nice to be here.
All right. Thanks, Sarah. Tanya.
Hey, hi, everyone. I am Tanya Bautista. I am the Supportive Services Bureau Chief. And in my bureau, we actually have the Digital Divide Program Manager. So we are doing several initiatives for Digital Divide on behalf of the Department of Aging.
Very excited to see that there. And I'm going to round out CDA with Mark.
Great. Good morning, everybody. My name is Mark Beckley. Glad to be here this morning. I am the Chief Deputy for the Department of Aging.
Really appreciate all the team's leadership over at the Department of Aging. Jody.
Hi, I'm Jody Mulligan-File. I'm with the California WIC Association. I'm a project manager here.
Mm-hmm. Jody also knows quite a bit about broadband from a previous life, so very happy to have her expertise here. And Karen, also from WIC.
Morning, everyone. I'm Karen Farley, the Director at the California WIC Association, the state nonprofit supporting the WIC agencies.
Great. And I neglected to say this at the beginning, and I think Department of Aging kind of talked about this a little bit, but we're gonna amend the introductions and ask you to say not only your name and organization, but why you're here. That's our little icebreaker question. So I'm going to give that to Sarah Bridge is up next. So Sarah, first one who gets to answer that question too.
I knew you were going to pick me, Katie. Hi, everybody. Sarah Bridge. I'm the Senior Legislative Advocate for the Association of California Healthcare Districts. We represent the 76 healthcare districts throughout the state of California, and I'm here because our districts want to get involved in broadband and are actually starting to do some work with ITEP and other great folks in the broadband space to bring interlock healthcare and broadband and expand connectivity in their communities. So that's where I'm here and excited for the discussion.
Great, thank you. Really appreciate your partnership, Sarah. We've been learning together. Sarah's been an incredible champion, not only offline, but also in the legislature on this. So happy to have a partnership. Robbie, go ahead.
Sure, I'm happy to. Robbie Franceschini, I work with Blue Path Health and also am representing in different capacities a couple coalitions, including the California Telehealth Policy Coalition and eConsult Work Group and Connecting for Better Health. And I'm here because I think broadband really touches all of the work I do in health IT and data sharing and telehealth. And, without internet access, I don't think we'll see, telehealth fully come to fruition in the way it really should. And, I don't think we can kind of see the data sharing or patient access to records that really relies on internet access to be able to use your phone or access apps and things like that. So thanks so much for inviting me.
Absolutely. And Robbie's been a great partner in multiple coalitions that we partner in, and appreciate his big thinking on this, because this requires big thinking. Maria.
Hi, everybody. So happy to be here and happy to see some familiar faces as well. My name is Maria Kalina. I'm the Executive Director of the California Collaborative for Long-Term Services and Supports. I'm fairly new in this role, but I've served as a consultant to the organization since its inception in 2011. We are a coalition of nearly 60 organizations, providers, labor unions, consumers that work on aging and disability issues. And I think broadband is an important topic because we know that there is a digital divide for older adults, which was certainly highlighted by the pandemic. And so really interested in this conversation and understanding how we can plug in and better serve our community. Thank you.
Thanks so much, Maria. Excited to have you here. Sarah Baches.
Good morning. Sarah Baches with First Five California. I'm their new Deputy Director of External and Governmental Affairs. As part of our policy agenda under our Resilience Family and Communities, our goal is to ensure that every family has equitable access to services that are transmitted digitally. And so we're really proud of this. And just prior to my coming on board, we fought really hard as a K-12 consultant when I worked for the K-12 space just recently in being champions of the $6.5 billion broadband initiative that we were able to successfully get in last year's budget. So my goal is really to make sure that we keep pushing and now in the delivery side of making sure all of our constituents have the means to access services. Thank you, Katie.
Thanks for being here, Sarah, and thank you for your incredible advocacy and being part of that team to, frankly, letting us have a conversation today, since there's literally billions of dollars in broadband because of some of the work that you did. So thanks for being here and bringing that voice. Let's see, Maciel, please go ahead.
Hi, everyone. Good morning. My name is Maciel. I'm the Director of External Affairs for Native American Health Center. I'm excited to meet all of you and see how our members can have more equity in all of the digital telehealth things that we'll discuss today. So thank you for having us.
Wonderful. Thanks so much for being here. Let's see, I've got Jim next.
Good morning, all. Jim Hickman Strategies. I'm an independent consultant working on initiatives around innovation for underserved populations. I come to this conversation because I was running a clinic in March 2020. One way to shut down in-person visits and figure out how to use whatever we had in front of us to connect with our patients in the Bayview Hunters Point community. Since that time, I've worked on a number of vaccine outreach and hesitancy initiatives, again, where digital tools could have made an incredible difference and did where they were available. So really excited to hear how we take those experiences and make them a standard part of the tools that our communities have to use for their health and well-being.
Thanks so much for being here, Jim. Let's see, Myra, please go ahead.
Hi, good morning, everybody. Myra Alvarez with the Children's Partnership. Excited to see familiar faces and meet new ones. The Children's Partnership has a long history of digital equity work. We were founded at the launch of the information superhighway. So really, I think our history is deeply connected to digital equity. And now as we are working to advance child health equity, we can't advance that without really thinking about broadband, internet technology, hardware, as we have seen most prominently in these last couple of years. I'm so excited to be here, and thank you, Katie, for including us.
Oh, thank you for your leadership. And, when I think of the Children's Partnership in this space, I just love that you're bridging the education and health gap with all of your telehealth work in schools for many, many years as well. So thank you for that. I'm going to go with Gabriella. Please go ahead.
Hi, good morning, everyone, and apologies, I'm not able to go on camera right now because of some internet issues. But I'm Gabriella. I'm the Managing Director of Policy at the Children's Partnership. It's great to be here with you all. Just adding to what Maida just said, we've also been engaged in some community-centered research around the experiences that families of color have been having utilizing telehealth and really understanding the digital inequities that they're facing. So it's great to be in this space to discuss those kinds of issues with you all.
Great, thank you so much. So happy to have you here. Keeping with the children's theme, I'm gonna go to Mike next.
Thanks, Katie. Hi, everyone. Mike O'Day, Senior Director of Health at Children Now. I'm interested in learning more about the health and technology intersection in terms of how to improve access and well-being for the children, youth, and families we're serving. So I'm a little bit personally new to this space, so interested in learning a lot of what the work that's been done already. So thanks for letting me join.
Absolutely. And Mike, I know you're new to this space. We were new to this space too. We literally Googled broadband for all about 18 months ago, and that's how we jumped into this. So the good policy wonks that we are, we've been learning a lot about a new policy area too. So thanks for being here. I'm going to go back up on my screen just a few more. Brianna Rivera, please go ahead.
Hi, good morning, everyone. Happy Thursday. My name is Brianna Rivera. I'm the Member Services Manager for the Native American Health Center. I'm here today to represent Greg Garrett, our COO. Something that our agency is interested in is in ways in which the broadband could support low-income and uninsured individuals.
Perfect. You're at the right place. Thank you. And Greg I appreciate that Greg has had both you and Maciel join us this morning. He's been a great partner to us over the last several years. Lauren, go ahead.
Hi, Lauren Jacobson here with Blue Path Health. I'm here to support Robbie Franceschini as part of the Telehealth Policy Coalition. And yeah, excited to be here, excited to learn more.
Perfect. Thank you, Lauren. Carrie.
Hi, everyone. Carrie Sanders, Senior Policy Director with the California Pan-Ethnic Health Network. We did a bunch of research at the beginning of the pandemic on the experiences of diverse communities in impacting telehealth, and we're part of the DHCS work group. So we continue to follow this issue and are really interested in the conversation today. I apologize, I have to hop off a little early, so I might not make it to the discussion part, but I'm really looking forward to your presentation and to connecting with all of the folks on this call on this issue moving forward.
Thanks so much, Carrie, and appreciate your and Karen's leadership and CPEN's leadership in this area. And just happy you're here because we've gotten a lot of questions. There's, you'll see there's a little bit about digital redlining on here. And there's also a lot of questions as we're signing people up for internet about language access. And so among many other items that I think are CPEN will have quite a bit to say about. So thanks for being here. Flora, please go ahead.
Oh, I'm sorry, I got to the
It's okay.
party late.
Name, organization, and why you're here.
Thank you very much. I'm Flora House. I'm on the California Executive Council for AARP. 50 years, retired as a nurse. I also have the luxury of sitting as a stakeholder on the California Coalition for Telehealth. And basically just an interested consumer, more important than anything else. So thank you.
Thank you. So happy to have you here. Yvonne.
Hi, everybody. Good morning. My name is Ivan Barragan with the California Immigrant Policy Center. I co-lead the Health for All Coalition, which is expanding Medi-Cal to everybody regardless of immigration status. So, technology and broadband is super important, especially as we're moving more towards that. And, our specifically for us immigrants, have a hard time sort of getting access to those services. And so how that impacts Medi-Cal and their use of services is super interesting and important to know. So that's why I'm here.
Absolutely. Thank you so much. And big congratulations to you and the Health for All Coalition team. So yeah, let's just take a moment. Congratulations. Really happy to have you here because I think we're excited to talk about making sure that healthcare coverage is meaningful. And I think digital equity is a key piece of that. So thanks for being here. Let's see. I think I've got a couple more. Noe, go ahead.
Good morning, buenos dias. Noé Paramo with California Rural Legal Assistance Foundation. And I wear a couple of hats, and one is a legislative advocate, and the other is a project director, and I'm in Marasco, Stanislaus County. And our focus is rural farm worker communities, and in this area to improve access to care and coverage. And as we see the expansion of Medi-Cal, to make sure that farm workers, particularly those who are undocumented and mixed status families, don't fall through the cracks. So to close that, and we're in several coalitions. So of course, Health for All Coalition, the Having Our Say Coalition, San Joaquin Valley Health Fund. I also sit on the CMSP Policy Board, and more recently working with UC Merced in the Farm Worker Health Study that we expect to see preliminary results coming out. Thank you, Katie.
Awesome. Yeah, no, I thank you for being here and for bringing that really important perspective. And Joe, I think you're our last one. Last but not least.
Thank you for that. Last but not least, so I'm with the ARP California team. Let me see if I can start my video. There you go. Oops, double click. So I'm here as part of Flora's team, ARP California, well represented here. I see familiar faces. Robbie, good to see you here. So I got invited to this through Robbie. So Robbie, thanks for extending the invite. But ARP California is a wise friend and a fierce defender of the 50+ population. And Maslow missed in the hierarchy of needs, missed the high-speed internet connection. So we're weighing in on this issue because right now it's no longer a luxury, it's a need. And so I'd like to hear from different perspectives and how we can weigh in and make affordable and accessible high-speed internet connectivity to all people.
Perfect. Thanks so much for being here, Joe. Could not absolutely appreciate how you framed that. So I think I got everybody. And really appreciate you all taking the time to actually go through real introductions. We could have done it in the chat, but I wanted to make sure you saw sort of the group and breadth of people that are on this because I think it's exciting to see people who are curious about this. So I'm going to share my screen and hop through this presentation relatively quickly, and then we'll get to a discussion and see where we want to go. Just a second here. And for those of you that have seen me or Marissa do a bit of a version of this presentation, we promise it's a little different, but wanted to make sure that we had a chance to just level set with the whole group. So when we think about this, the title says it all: health, equity, and the digital divide for us. We went through our introductions and our icebreaker question. It's a little bit about ITUP. I think you're all here because you mostly know about ITUP. But we do have our mission, vision, and values, and it really is trying to make sure that Californians have a fair opportunity to live their healthiest lives. And of course, we seek a health system that is universal, equitable, accessible, effective, and affordable. And that those values also translate, I think, upstream to this broadband and connectivity conversation. We have sort of an overarching thinking in our strategic plan, really focused around the future of health. When Insure the Uninsured Project was founded over 25 years ago, insuring the uninsured was the future of health. And now we're so excited through the work of many folks on this call to really get to broaden and deepen that work from not just coverage and access, but also to delivery system transformation and making this system work for the people that have coverage and the people we serve, as well as technology and data, which you heard several people talk about. It's to make all of that work, we need to have connectivity. So the convening goals, this is a bit of a new type of group for us, and that's why we only scheduled 2 meetings. We wanted to get all of you on the phone, have the conversation, and really be here as a resource for you. So our goals today are to inform you. So really bridge that knowledge gap between healthcare and broadband. When I think about this, I'm really thinking about the potential of creating connectivity so that we can do virtual care, which hopefully will get us to better health outcomes. We know that technology is not the end all be all, but I think the pandemic really accelerated its use, and it's very exciting that we can now use it, I think, to hopefully its fullest extent. The second piece is really to identify opportunities for you all to engage. This is a mostly statewide group, and several of you also engage in statewide associations. There are multiple places where the health sector can actually engage at the state, local, and national levels, and we'll talk a little bit about that to see what's best for your organization. And then finally, activate. I know that that's a bit of a strong word, but there's a lot going on in the broadband community. There are a lot of stakeholder engagement opportunities, and from what we have discovered in our 18 months of working on this, so the broadband community already thinks that the health and human services communities are engaged. And from what we've seen, yeah, I see Flora shaking her head. No, we're not. And I can talk a little bit about that. As I said, when Mike introduced himself, we really came to this studying a new policy area, where I think many of us are steeped in telehealth and data. And I think we all know what that evolution has been over the last 10 or 15 years, and that we're still having that conversation. So really looking forward to bringing that, we've been bringing it to the broadband policy folks and talking to them about how to speak to health and human services organizations and the value that those organizations can bring to the conversation, because we're all serving the same folks. So really, I think we talked about this, and I think you all probably have answered this question, and that is sort of the threshold of why you're here. We really want to achieve the potential of telehealth and virtual care, of data exchange, of health access and equity. We've got a lot of work to do. And in California, I think we're very lucky to be able to have this conversation. A lot of states have not expanded Medi-Cal, have not achieved coverage gains like we have. We have. And I know we're going to continue to make the most of it to make sure everyone is enrolled and has that coverage. But we also want to make that coverage useful. So when we think about it, this triangle really sort of represents how we think about broadband. There's, at the heart of this, it's equity and affordability, making sure that the people who need it have internet and that it's affordable and they can access it. So that's connectivity and infrastructure. That also includes having devices, not just your smartphone, but maybe it's a tablet, maybe it's a Chromebook, maybe it's a laptop, et cetera. And then digital literacy is also a key piece. And I know many of you are actually working on some pieces of this pyramid. And so we're really trying to bring them all together. It's really all of them. So just to level set a little bit, I actually love this graphic. As you can tell, I like slide decks. Since I've been in leadership at ITEP, we've shifted to infographics and fact sheets. I think we're in a Twitter age. We like pictures, and so for me, this is really the easiest way for me, and I hope it resonates with you as well, to understand what broadband is. I left the words in there for those of you who like the words, but this is really when the broadband folks are talking about broadband. This is what they mean. There's that backbone long haul that really goes across the country, and it even goes under oceans, which is really exciting. And then the money that Sarah Bacchus talked about that was in the 2021 budget, that's for middle mile mostly and some last mile. And that's really what we're going to talk about today. And those are the places where there are stakeholder opportunities. The middle mile, think of it as like a highway, like I-5 or I-99, really big fiber cables connecting big hubs together. And then the last mile is getting from those hubs into communities. And then there's to actually the houses as well, going from these big buildings actually out into individual houses and communities. So hopefully this helps you. I know this helped me understand it, and I really appreciate this visual. And then the question is, how much broadband do you need? I really appreciate Joe's comments. it's not just, it's not just a nice to have, it's a necessity now. And this is a chart from the federal community, from the FCC, but we actually found it in a LA County broadband publication. And for me, this really resonated because, think of your own personal use at home. 8 megabits per second is not going to get you very much, right? Yeah, thanks, Noe. My own, I've got a partner and three kids, and even though my children are 5 and under, we're still doing essentially every day medium to heavy use. To do what we're doing today, to be able to share my screen and do a presentation, you need at least 15 megabits per second in what we call download speed. And just to give you a sense, or in upload speed, just to give you a sense, the federal the federal sort of standard is 25 download speed, 3 megabits per second up, and you really need about 15 to present it virtually at a conference, just for example. So we really need high speeds, and to get those higher speeds, it costs more money. So that's why the affordability component and equity component is really important here. And then finally, there's a broadband infrastructure conversation. When we get from the backhaul, middle mile, last mile graphic that I showed you, the last mile pieces, and I think this is a really important place where where health systems and advocates and particularly health facilities, so hospitals and clinics can play a big role. Connecting, you can actually become what's called anchor institutions in your community. So you can connect that last mile from the middle mile to the last mile to your facility and get that internet out to really underserved communities. And I think that that's incredibly powerful. And that goes hand in hand with something called digital redlining. You go, wow, redlining sounds really familiar. It is what it says it is. We've redlined communities, and that also includes from a digital perspective. People with lower incomes and in more marginalized communities have less access to internet. There's a huge sort of group of study in this area that the broadband community is doing. And so we've actually there's some comments that we can make available to you on our website, but we've actually put in some comments to the California Public Utilities Commission on this topic, saying that when you're thinking about this, it's not just digital redline communities, it's people who are Medi-Cal eligible. It's folks in other, we're all serving the same folks. So we're going to talk about all of this, but I just want to make sure that you all understand there are local infrastructure conversations happening that the broadband community thinks that hospitals and clinics and other facilities, I think even, for the aging folks, I think even potentially, community centers or senior centers could be very interesting. Noe in the Central Valley, they're talking about, how can we, utilize, hubs where farm workers are to connect last mile in and be anchor institutions. I think we can be really creative here, but the broadband community doesn't know how to engage with the health folks. So we want to make sure they know that the health folks are here and that we want to be part of those conversations. All right, and then this is just a map, an example of digital redlining. These maps exist and folks are working to make it even more apparent. So that gets us to sort of these commitments in closing the digital divide. So why are we talking about this right now? And this for me, this has been for us a year and a half of policy discovery, which has been really fun for me to learn a new policy area. But there are multiple sort of money commitments, right? We all work in policy, and I think we all understand that sometimes you have to follow the money. There are a few things that are really bringing health to the table and broadband to the table in a big way right now. As we said, the state has a broadband for all initiative. This is almost unique across the nation. The fact that the administration, the Newsom administration, has put in $6 billion in the 2021 budget and just added about $500 billion more to account for inflation. We have about $6.5 billion to literally build fiber across the state. It's incredible. And but the folks who are running this are not our typical health and education sort of regulatory entities. It's actually the Government Operations Agency, the Department of Technology, which falls underneath them. They're leading both the last mile and the middle mile conversations and stakeholder groups, and they staff the California Broadband Council. And then there's also the Public Utilities Commission, California Public Utilities Commission, that I know most of us have never engaged with or thought about engaging with. There's actually money there for anyone who wants to be an anchor institution, who wants to do outreach and enrollment in affordable broadband programs. There are a lot of opportunities there that I know were very new to me that I never knew existed till we started doing this work. And so we not only want to make sure you all know about it, we want to make sure your partners and members know about that. And then if you want to apply for it, we're in the process of applying for some of these funds today to test this out. But we also have partners on the broadband side who do a ton of work with the CPUC and have for many years and really know how to work with that group. And they are providing technical assistance to groups like ours and to anyone really who wants it to engage more in those conversations. And then finally, there's a huge federal investment in broadband. You've probably heard that there should be billions of dollars coming to California, whatever that means. We're going to talk a little bit about that and how to engage, how those funds are coming to California. So roles for health organizations. So as I said, there are multiple opportunities here for health and human services and education folks to engage. And just a note on that, since we do have some folks who I think work across health and education lines, the education community is relatively connected. And I think a lot of that was accelerated because of COVID and really trying to get internet out and devices out to families so that they could do actually just do school. We all know how that went. It certainly was less than perfect. And our colleagues have a lot of thoughts about that. But they're relatively connected. The vendor who's working on the middle mile program for the state has an education background. So they're pretty connected in from an infrastructure perspective with the schools, but they are not connected really with the health facility side of things. So there's a local infrastructure opportunity. The CPUC actually sponsors groups, regional groups across the state called consortia. And so if you have hospitals or agencies or members in communities across California, there are actually folks in these communities who are funded by the Public Utilities Commission who are supposed to be organizing folks at a local level in this. So there are local opportunities to engage. And if you're interested in that, if you're not engaged with them, let us know. We can certainly get you connected to each of those consortia. We are also finding that it's a bit, not surprising, right? It's a bit of a patchwork across the state. Sometimes counties are very engaged. Sometimes regional areas of government are engaged more than the consortia. So it's a little complicated, but if you have folks who want to engage, or if you yourselves want to engage at that local level in those infrastructure conversations, huge opportunity. They do not know how to reach out to the health systems. We are finding that slowly folks are starting to get engaged, but it really there are really big opportunities there. As we said, you can become an anchor institution in the community. And if you want to, we're happy to talk more about what that could mean specifically for you or any of your members. But that also really means that they need to start engaging at a local level. But there's also and then there are also the policy opportunities, the state engagement. There are the middle mile and last mile policy and planning. There are stakeholder conversations being run by the California Department of Technology and the CPUC that I think many of you who are familiar with lobbying would know how to engage here, but there aren't any health voices really other than ITEPs at the table. And so we would love to work with any of you who want to learn more about this, and we'll talk about kind of some of the next steps here. And then if you really want to get excited, there's some national coalitions working on this. And the two key ones, we are a member of the Schools, Libraries, and Health Broadband Coalition. They're focused specifically on anchor institutions. And there are a few folks from California who are highly engaged in this coalition. And they have some good resources, and they've been great for letting us know sort of what's going on in the federal policy space on this. And then there's a group called the National Digital Inclusion Alliance, NDIA. And they are also a wonderful source of fact sheets and things that will just give you a picture into what's going on. They're pretty understandable. Finally, there's a short-term solution here. I say solution in quotes. There's a federal program called the Affordable Connectivity Program, and it actually gives there's a way for people who are Medi-Cal and WIC eligible, among other programs, that you can actually sign up for this and get a subsidy on your monthly bill. I know we've given some presentations to the California Telehealth Policy Coalition on this, the Connecting for Better Health Coalition, and also appreciate the California WIC Association folks on the line. We've presented to their directors as well. Wonderful, wonderful opportunities in this area. Like most public programs, it is not easy to sign up for this. So we have partners who have consumer helplines that can help with this. So this is another opportunity to start moving in this direction. Finally, we have links here. I talked through many of these. This is more for your reference. These are the folks in California who are where there are stakeholder opportunities and where you can engage. We talked about the consortia. We talked about funding opportunities at the CPUC. We talked about the California Department of Technology, specifically the Broadband for All initiative. There's a link to it, a hyperlink. The two places where you can actually just show up and give public comment, like many of us all do. The Middle of Mile Advisory Committee meets monthly, and the California Broadband Council meets somewhere between 4 and 6 times a year, a little more ad hoc. And then forthcoming, which I think is really our goal here, there's going to be, to access a lot of that federal money, the states, every state, including California, and California is planning to do this, we need to create a state digital equity plan. And I think this is where many of you can come to the table and would be most appropriate for you to engage at a state level. They're still working on the stakeholder process for this, but we've made it very clear, they're intending to include education, intending to include sort of economic opportunity. But we've also made it very clear that they need to engage with the health and human services community. We have not been shy about giving them suggestions on a few folks who should be already included in that process. So we're expecting this process to happen starting in the fall. And we'll certainly provide you more information on that. And not surprising anyone on the phone call, you can also engage in the state legislature and the state budget on this. And I'm not going to go into that in detail, but if you have questions, we've got folks for you to talk to and can talk more about that as well. Just a quick snapshot into who we're partnering with. Some of you may see your names up here. Obviously, there are many other folks, but these are just a few. This is I feel like a really good mix of health and broadband entities. So you can just, in your spare time, which I'm sure all of you have, but if you are interested, there are statewide coalitions advancing digital equity called the CADE Coalition. There's Human IT and the California Emerging Technology Fund do a lot of consumer help on that affordable connectivity program I mentioned. Telehealth Policy Coalition, Department of Aging, you all are doing incredible work in this space already. So we have a lot of folks here who are working together already, and we'd like to add more names to this list. This is not, these are just our partners. This is not an organized coalition, just to be clear, but just to give you a sense, there are a lot of folks working in this space, and we have a lot of contacts that we would be happy to connect you or anyone you want to talk to with. So, discussion questions, would love to just know, well, I'll take this slide down and we can all see each other again, but where will your organization engage? Do you want to engage? Do you have questions? We have, another meeting coming up. We decided to do 2 meetings. Our next one is July 19th, where I think we're hoping to bring maybe a couple speakers from the broadband community, probably hopefully someone from the state to talk a little bit about what they're doing and how the health community can engage, and actually to introduce them to you all and say, hey, there are actually a group of folks here who really do care about this issue, and we exist and you do need to engage with us. So giving them an easy way to meet sort of our community here. And then there's actually a public meeting about 3 days after that, no coincidence. So if you wanted to come out of that meeting and actually go and give public comment or listen to a meeting, there's a meeting on July 22nd, it's a Friday morning, and they webcast it all. So it's very easy. And they have a form that you can give public comment. And then there's also a California Broadband Council meeting as well, about a week after that. And then again, opportunities to plug in your local infrastructure and engage in ACP outreach. And then the rest of the PowerPoint presentation are really just resources for you. So we tried to start with fact sheets, and there are some key terms, and there's obviously a lot more behind this. But we really wanted to create kind of a high-level glide path for you all just to get familiar. To the extent you aren't familiar with the terminology, that seems to be the key. So with that, I'm going to stop sharing and open it up. Feel free to use the chat if you'd like. And I'm going to open it up. Does anyone have thoughts or comments? Or you can answer the question, how do you think your organization might want to engage in this? We really want this just to be useful. Thanks, Maria. I see some clap. You go ahead.
Sorry, I was trying to raise my hand, but I think I ended up hitting the clapping button, which is fitting because that was such a great level setting presentation. So I appreciate that, Katie. I was thinking about answering the question that you posed, which is how does your organization feel like it might be able to plug in? And as I was kind of listening to the presentation, I was thinking about we sort of have two levels of membership. One is statewide organizations like AARP and UDW, and our second level of membership is really our regional coalitions, which are local providers, local health and human service agencies. And I think for me, it kind of makes a lot of sense for this information sharing to take place at the local level. I can see some of our folks being really interested in becoming anchor institutions, as you noted, at senior centers, community centers. So that's something that just kind of, it was like a light bulb going off in my head, that there's more education needed at that local level to just let them know that the opportunity is out there and this is how you can plug in. But I think also at the state level, just being engaged in advocacy efforts. And it's, I don't know if everybody else is feeling this way, but there's so much going on and so much stakeholder engagement going on that you don't always know when to plug in or how to plug in. And so I appreciate that guidance as well. I think that was really thoughtful to give us a heads up. There's a public meeting coming on and here's how you can kind of participate and share public comments. So I'll definitely throw that on my calendar and try to track down that template and see how we can plug in. But I think for me, I'm thinking that two-prong approach. It's the information sharing at the local level, just so people know the resources are there, but then also stepping into the advocacy space and just having a voice in the conversation, I think is really important.
Yep. Thank you. Absolutely. Thanks, Maria. And, as I said, this is our first, I think, attempt to really bring all of you together and figure out what's going to be helpful. And I think it'll, as you said, I think this group in particular, we're calling it the statewide group. I think, most of you engage or have team members who engage at that advocacy level. And as Marissa says in the chat, they are really absent from this. It's literally ITUP poking them every meeting and saying, hi, what about anchor institutions? Have you talked to the hospitals? I know CDA is doing a ton of work on the back end and really appreciate the work that they're doing to bring the voice within the administration. But hearing, as we all know, they need the stakeholders at the table as well to move a lot of this forward. So Maria, thank you for that. And, I think we should think about at the local level, we can think about, do you need talking points? Again, I think we're really coming at this from what tools can we provide you and your members and your team members to really start to engage on this. So we've got a lot of educational materials, but this is really helpful for us thinking through what we might be able to give you next. Flora, go ahead, and then Robbie.
Thanks, Katie. So I have a couple of statements that are on different levels. One, certainly as an EC member of AARP and making sure that every access is available for older Americans, because we're all over the state. So obviously partnering with everyone here and especially the Department on Aging is critical to me. Two, I'm thrilled about the fact that you have bombarded us in a beautiful way with so many opportunities to get further involved. I definitely need the slides because there were too numerous to count to take a quick picture to say, okay, I need to go to that site. So that was great. Three, in terms of education, one of the things that concerns me, and this is the part of me that's not a pure AARP, but is 50 years as a nurse, the last 10 years as a nurse educator and researcher. I am also concerned that the digital divide has an aspect of digital literacy that needs to be brought down to the consumer level. So there is that piece of it that I'll be, checking in on and figuring out when I can help. And the other thing, my last point on 4 is, as a member of the Association of California Nurse Leaders, I will absolutely continue to be a part of this group to bring the message to those leaders who represent healthcare systems across the state. So use me, abuse me, thrilled to be a part of this today. I will miss the next meeting because I will be on vacation in Italy, but back shortly thereafter. Thank you.
Flora, thank you so much, and appreciate it. You know, and we've done some of the and talked about doing presentations with specific associations, and so we're you know, we're working on, frankly, staffing up so that we actually can do more conversations like that. So if at some point, you know, just as an example, you want us to come and speak to another organization with members, we can always, you know, adapt this type of a PowerPoint to that group.
Yeah, because they need to bring the healthcare systems to the table as well, whether to be anchors or to be better representatives for the communities that they serve. So thank you.
Yeah, and I appreciate you highlighting the digital literacy side of this. This is a huge topic of conversation. The broadband community is a little amusing to me to say, oh, we really need, you know, digital navigators in the community. And we said, hi, we're the health people. We have community health workers who are employed by counties, nonprofits, state, organization, who we would love to plug into this, who are already doing a lot of this work and who are actually really embedded in communities and already trusted messengers and can do this not only, you know, in other languages and in culturally appropriate ways. So we have a community health workers fact sheet, and we've been sharing this with the broadband community when they talk about digital navigation and literacy. And, you know, we call broadband the gift that keeps on giving, because conversations like this, we go, oh, well, and here's this piece, and here's this piece that you should engage. So keep talking about it. I think the more they hear from all of us, the better. You know, our purpose in this is just connecting the dots and leveraging what we already have in a very scarce resource area. And just for, I know we have AARP on the line, so just in case, and Department of Aging, we do have a Medicare and Healthy Aging fact sheet. So in case anyone's wondering who that population is, it's over 6 million people in California. And I feel like since we don't put a lot of California State General Fund in it, we don't talk a lot about it at the policy level. But I just want to highlight how important this community is in this conversation. Robbie, go ahead.
Thanks, Katie, and thanks so much for all the good content. I think one thing that could be helpful, especially kind of from like a managing coalitions lens, is having space for, I think, obviously like knowledge sharing and information sharing, but also maybe too for discussion around like analysis and, okay, if there's an opportunity for public comment, you know, what kind of point of view should healthcare organizations be bringing, so that maybe we can bring those back, you know, to our coalitions, and maybe use this space here to kind of like flesh some of those ideas out together. I think that could be one purpose that I think I'd find super useful in terms of, you know, going back to the telehealth coalition with Joe and Flora and others and saying, all right, team, you know, an education committee, you know, here's how we can really help support digital literacy or with the legislation committee around something with policy. So I think some sort of space like that where, you know, we can kind of all put our heads together would be super helpful.
Yeah, thank you. I really appreciate that. You know, we can definitely use help on bringing a coalition together. So thank you. I appreciate that. And more to, I think that we're definitely having an offline conversation with you on how to organize that in the best possible way. Mark, please go ahead.
Great. Thanks so much. And Katie, thanks for bringing everybody together. This is a great convening, and really enjoyed the PowerPoint. I think at Aging, we could definitely use the help of this coalition. We have 3 digital initiatives underway right now. One is to deploy 4,000 iPads out to older adults through our AAA network, with the idea of like mitigating feelings of isolation and you know, depression. So that one's, you know, well underway. The second one I think is really relevant, which is our Digital Connections program. That's $17 million that will go out to CBAS, MSSP, possibly PACE providers, to help with telehealth services, as well as to mitigate loneliness and isolation. So just getting people's thoughts and ideas, how can we structure that to be an effective, I'll call it a telehealth pilot, and you know, how should we go about doing the evaluation? And then I love what Flora said about digital literacy. Absolutely. How do we make our trainings really simple, easy to understand, so that it's, you know, it's not overly complicated. We are working with a number of different digital training vendors. And, you know, the struggle is it's easy to deliver the training virtually or over the telephone, but it's not always effective. So where are those people in our communities that can also serve as effective trainers? And then finally, we also have what's called our Access to Technology project, which is $50 million in grant funding out to counties for them to build upon existing digital programs. But again, are there sort of like telehealth resources or tools that we could share with them to help augment support their programs as well? You know, and as always, as you said, CDA is more than, you know, willing and actually excited about being a voice for health. So working with DHCS, CDT, and others to really, you know, bring health into more of a conversation. So those are my thoughts. I'll also turn to Sarah and to Tanya to see if they have any other ideas from CDA.
Thanks, Mark.
Sure.
Sarah?
Well, actually, I'd love to hear from Tanya, who's leading this at the branch level. So if you have anything to add to what Mark had to say.
Yeah, absolutely. Digital literacy, as far as, you know, I love that triangle, Katie, that you had on your slide. That's exactly what we have in our mind as we walk through and keep the bigger picture focused through each of these initiatives. So, you know, the connectivity, the devices, and then of course, digital literacy, and how can we, you know, support that from an equity standpoint across the state, and the access therein. So when we talk about digital literacy in particular, you know, what does that really mean to us as a state? How do we measure that effectively and get this out to the different folks that we can reach in our communities through the Department of Aging? We're definitely partnering effectively with a few different entities and looking at the resources as Mark described. But one of the great resources that I think we're just starting to get familiar with is the California State Libraries and what they're doing. I provided a link there in the chat, and obviously when you click on it, it's going to look like career pathways, and you're thinking, why are these, what, you know, how does that benefit children, or how does that benefit older adults, you know, and seniors? But we've been working with the libraries and Get Set Up, and we've also met with, you know, the executive team of Get Set Up, and you can call their phone number that they have there, and you get a live person, and they will walk you through how to operate your device, so you can get their app on their device, and they will walk you through the entire process. And then on top of that, they know that California has this free connectivity through the local libraries. Because obviously if you sign up just through the app, you only get like 5 classes and then you have to pay. So they'll connect you through this whole process. It's fantastic. And they get everything from how to use Zoom and my charts to, like, you know, yoga classes. And if they really get engaged, they can even start teaching their own classes and they're a little bit of side cash. It's a pretty cool program. And that's something that's available again through state libraries. And they are relying effectively on networks like this, you know, these kind of work groups where we're communicating effectively these resources, because that's how you get to that, you know, kind of tipping point where everyone sort of knows this is there and they start utilizing it. New York, the state of New York, they have Get Set Up where, you know, they went from just a few thousand individuals using Get Set Up to now millions of users. So yeah, that's effectively what the library is hoping to be able to achieve here in California. And it really has a good impact on digital divide as far as digital literacy is concerned, which would be help. Yeah, that's one thing that we can do. But obviously, as Mark was saying, with digital literacy, you know, really giving them that case management opportunity, hands-on. There's a lot that goes into it. So
awesome. Thank you, Tanya. I know there's more to come. I'm sorry to cut us a little bit short. We only have about 4 minutes left, so I just wanted to pull out. There's a lot of great stuff going on in the chat. We're going to save this chat and have that inform us as well. So if you have something else to share or share links, please go ahead there. I do want to just give a bit of space to anyone sort of in the child health space. who wants to add something in here. I don't know if Myra wants to talk, or Sarah or Mike would love a little bit of your lessons learned and thoughts in this as well. Myra, do you want to say something real quick?
Sure. Be mindful of time. There's a few things happening. So here at the Children's Partnership, the third report in our racism and child health series will focus on digital equity, really thinking about how racism is baked into our digital infrastructure. And that actually is very similar to a report that the California Department of Public Health just released under its Essentials for Early Childhood initiative. That didn't get a lot of attention, but I think is a
happy to look that up.
Yeah, is a really good report that I think really aligns well with what we've been talking about here. Just the connection between digital equity and well-being. Okay. So really interested to think about how the broader conversation is considering not only the digital literacy, but frankly, like economic security aspects of it. I mean, there's just so much intersection of issues. So that's what we wanted to share.
Awesome. Thank you so much. And I think those will be great resources that we'd love to share and put into the mix here. I don't know if Sarah, do you have any comments you'd like to leave with us? Or I know you're just sort of listening to this from a new perspective. So not sure if you wanted to say a couple things before we sign off.
And I'm wondering, me, Sarah, or
sorry, yes, Sarah Batches.
As a Sarah, you're always used to being like Sarah D and Sarah D.
Yep.
I'm just very grateful for the opportunity. I am new to your space, but not new to the issue area. So as you started talking about the July 19th meeting and preparing for a future hearing, I'm wondering, as we engage and start hearing next steps and actions, if there is any interest in subcommittees, I'm more than happy to partake in that as we start developing maybe around points. So for me, it's doing my homework for the next time and really coming up to speed, because all of the issues that were mentioned today, of course, affect all of our families and their little ones. So just making sure that we can be connected and that I could be a vessel to communicate that as a voice. So I just appreciate the rich discussion. Thank you so much.
No, thank you. And great idea. If this really turns into coalition, subcommittees are going to be a great idea. So thank you for that. This is sort of our test case to see what would be useful. Noe, I see you putting a lot in here, so I don't know if you want to round out the conversation with the last couple thoughts.
So just on the access to broadband using the libraries, particularly at the local level. I think that's very important, so they have access. In our experience, working in unincorporated small communities, is that they restrict the hours. They pull back hours, and it's a resource thing. It's a capacity issue. But after hours for our seniors and our students is limited. So then you have to advocate at the local level to make sure that opens up. So that's an issue that we just got to keep our finger on to make sure that is
perfect.
Made. Thank you.
Thank you, everybody. So yeah, thank you. Thank you all again for coming and talking about all the work you're doing and helping us connect all these dots. So really appreciate it. More to come. If you have other colleagues who are interested in this or other folks in your organization who you think you should be engaged, please reach out to us. We're happy to extend an invite to them. And as said, also happy to set up some individual meetings as well, if that would be helpful with the communities that you represent. So thank you all, and happy Thursday. Talk to you all soon. Bye.